I am open to Module 9, which is the last module we will be covering in week 4, and it will go over Chapter 10, which is all about the hospital. So the hospital setting, different procedures that take place within the hospital, and then the effects on patients. So let's take a look at the objectives for the chapter. We're going to be looking at the history of hospitals and hospitalization in the U.S., the different, I should say, the various structures that belong to hospital organizations, so the hierarchy of how those are organized, and the common goals that hospitals have in treating patients, as well as the role of the healthcare professional. We'll be taking a look at the purpose of an infection control committee, which is a very important aspect of hospital operations, which basically manage the spread of infections within a hospital setting. Definitely coming more into importance today with COVID. We're seeing this governing body play a pretty big role within the hospitals than ever before. We'll look at how changes have affected hospitals over the course of the last, say, 40 to 50 years, what changes have occurred, and the importance of different hospital personnel and staff in relations with patients. So getting a little bit more familiar with the role of the various people within a hospital. Then we'll turn to more of the patient's experience now that we have an understanding of what the hospital setting is like. What is the patient's experience like in a hospital? Maybe you have or have not ever been hospitalized. If you haven't, some of this may sound foreign to you, but pay close attention, because chances will have it that at some point in your life you will be in a hospital, for an illness or an injury, or maybe a loved one. And so you'll want to be aware of some of these factors. But if you have been in a hospital setting before, have had a surgery or an illness that put you in the hospital, you know that one big key factor is depersonalization. So it's been the top complaint of patients for a very long time, in that when you become a patient in a hospital, there is a certain level of depersonalization that happens. You just become less of a person and more of like an injury or an illness. As doctors are struggling to treat you and care for you and figure out maybe even what your diagnosis is, the patient can tend to get caught up in a lot of that and feel sort of invisible. So we'll be looking at like what all of that is all about. And then the role of medical care professionals. They're a unique breed of individuals. There's a high burnout rate within the medical profession. So we'll look at some of the psychological components of that and the different challenges that exist for medical care professionals when it comes to providing treatment for their patients. We'll talk about what is a quote-unquote good patient and what is a bad patient according to medical professionals. What kinds of patients do they like and what kinds of patients do they not like? And how being a good patient can actually be harmful to you. When we follow all the rules and do everything the doctors want us, we would think that that's a good thing, but sometimes it can be harmful because we often know ourselves, we know our bodies, and sometimes we need to be our own advocates of our health care, in coordination, of course, and communication with our healthcare professionals. But sometimes if we don't challenge or question different diagnoses or treatment options, we may not be getting the best care that's in our best interest. So that just the dynamics behind all of that. We'll also look at patients' emotional reactions to hospitalization. What is it like for a patient being in the hospital? What kinds of feelings and emotions do they experience? As well as the coping process. So we've looked a little bit already at coping with stress. What does that look like for hospitalized patients? And how can healthcare professionals help patients to cope better in the hospital? In fact, that's one very huge role of a health psychologist, a clinical health psychologist who is in the hospital can often be that liaison between a medical care professional and a patient, whose main and primary role exists to help patients cope with their diagnoses as well as treatment options, especially so if the patient is elderly or a child. There's often people who help in that process to explain and give options for parents who might be faced with difficult decisions and how to treat their kids. They may not know a lot or how even to navigate the healthcare system. Their health literacy levels could be low. So oftentimes health psychologists play a pivotal role there in that, as well as preparing patients for medical procedures. Someone who's about to go in for an open heart surgery or about to have an organ transplant. These are big procedures. They can be scary. There's risks involved. So healthcare professionals play a vital role and health psychologists play a vital role in making sure that that process goes smoothly. So we'll be looking at that, but then even more so some special issues that are particular to the care of a hospitalized child. What's it like for children in that hospital experience, and what's the role of parents and family in that? So very much so getting familiar with the role of a health psychologist in a health or hospital setting. Also, the various tools used to assess medical patients for psychological testing. Tools used to assess medical patients for psychological testing. A great deal of procedures require patients to be psychologically healthy. You can't have patients going in for a serious medical procedure who are also at the same time combating anxiety or depression that could be fatal for a patient. So making sure patients are where they need to be, or if they're about to undergo a procedure, or if they've just been given a diagnosis, let's say of cancer, making sure to follow up with some mental health processing of what to expect, things that they might be feeling, how to treat that. So we don't just treat the physical disease, we also treat the psychological diseases that oftentimes go hand in hand with some of the physical diseases. And then so lastly, we'll be looking at terminal illness and some of the various issues surrounding terminal illness. And we'll talk a little bit more about this too in future chapters, which look more at some of these serious illnesses, which sometimes can be fatal and terminal, and the various issues surrounding those. All right, so that gives you a sense of what it's like to be in the hospital. There's no video that goes along with this for this module, but you have your lecture slides there. And then the discussion for this module centers around Chapter 10 in the Longevity Project, which is all about how healthy is your job for you. I know most of you are working at jobs that you will not have for the rest of your life. You have temporary jobs, some of which may be good and some of which may you may hate. So it is hard to assess the current job that you have, but you can go ahead and do that. But as you're doing that, I also want you thinking about the job that you want to have in the future. It's very important that you pick the job that's right for you, that's going to lead to the extension of your health, into your future. And we've seen in the longevity project, by looking at the termites, we've seen who picked well and who didn't pick well, whose career mapped onto their personality well and whose didn't, and why did that matter? Why did that end up mattering? So explaining the relationship between career success and health and longevity, using the termites as examples. Looking at the effects of workplace stress. This is a great place to integrate some of the Serafino and Smith chapters on stress that we covered earlier in the beginning weeks of the class. You'll also be introduced to what's called the self-healing personality. What is that all about? And then John Holland's categories for personality type and occupational environment. Where do you fit? So it's pretty much giving you insight into the termites, what their personalities were like, and then what kind of occupations they chose, and how did they fare based on that. So this is really kind of a pivotal chapter for you, the individual student, as you're embarking on, many of you, your future careers, of where you want to be and where you see yourself headed, to choose wisely and really think about the association between the career that you choose and your health. Having a longer, healthier life is going to be impacted greatly by the type of profession that you choose. So just take all the opportunity you can here to integrate in examples from the termites, as well as information from the chapters on stress, even though they were a couple weeks back, still definitely very applicable here to integrate in and kind of show off what you know there. All right, that would wrap up the module, and then you'll be ready for exam 3, which covers all 3 of those modules from this week. So chapters 8, 9, and 10 in the Serafino and Smith book, along with module 3, the physiological module 3 from chapter 2, which is the digestive system. So the exam is just like the others. You'll have 50 minutes to complete it. You don't want to be taking the exam too close to the stop time, or else it will cut you off and you won't be able to finish, and you will lose points for that, whichever you haven't finished. So make sure you leave at least 50 minutes, that's all you have, to take the test. If you start the test at, say, 11:39, you're only giving yourself 20 minutes. So you don't want to do that. You want to make sure to start with plenty of time to take that or to take that exam before it closes. So that would be exam 3. And again, that covers all of the modules within this week, modules 7, 8, and 9 for that test. Okay, as usual, please let me know if you have any questions about any of the material from any of the modules this week. You can shoot me an email and ask any questions, anything confusing, or you need extra clarification or help. I'd be glad to do that for you. Otherwise, have a great week.